So the use of MRD is still not widespread in clinical practice. In fact, it's mostly practiced at the academic medical centers, and you won't see much of that still in the community. But there was a recent study by a Spanish group that looked at the level of response in a large cohort of patients, and then they were interested in separating those who had a complete response into those that were MRD positive versus MRD negative. What they found is if you had a complete response but were still MRD positive, the outcomes were similar as if you had any other level of response, including a partial response. So if these studies continue to confirm that, it would appear that this whole classification that we have for responses in myeloma is a bit of an academic exercise. So our hope is that as these techniques evolve and they become more commonplace, our partners in the community will be using them more frequently, and they'll be applying that to their clinical practice. Now, because of the restricted use for transplant, it's kind of easier to see the link with an academic center, but a lot of people are out there in the community, and the prevalence of myeloma has greatly increased, where they're on chronic therapy and CR, and this may be a good way to approach that problem. Now, a purist will say, you don't have the clinical trial data. That's true. Some of that data is coming forward, but it's going to take a long time before we have it here. But I think it's a reasonable thing to do.